I am Commander Carrie Hudson, the Executive Officer on USNS Comfort. This is a video depicting a typical patient movement from ambulance drop-off at Pier 90 onto USNS Comfort and disposition into the various wards. In this triage scenario, our patient has been dropped off by the EMS team and turnover has been given to our local patient receiving team. Her current status is COVID screen negative, meaning she has no signs or symptoms or a temperature concerning for COVID, but has not been formally tested. She is going to be taken into our triage tent where she can be safely and expeditiously tested for COVID status. These are also temperature controlled tents which provide individual patient areas to protect patient privacy and HIPAA policies. As you are watching, the COVID test is being performed on the patient. This is both a painless and non-intrusive test. The test itself will take anywhere from 1 hour to 3 hours to be performed and resulted. This is due to how the test is run and whether it is performed using either PCR testing, in which multiple tests can be run simultaneously, or BioFire test, in which the test can be run one test at a time. This patient now has been determined that her COVID test has returned as negative. This confirmation has been verified several times by both the lab and the treatment team, and the patient is now cleared to be moved to the ship through the patient movement system. She will be moved safely across the brow and through the patient movement ramp up into the casualty receiving station, consistent with the other patient movement scenarios you have seen. The only difference in the patient movement system now is that she will be moved to a ward that is COVID-free because she does not require ICU care. If she required ICU care, she would then be moved to the COVID-negative ICU ward, consistent with an earlier patient movement scenario which you have seen. Again, all appropriate PPE for both the patient and the healthcare workers is maintained in accordance with DoD and CDC guidelines. Again, you will see the patient gurney being wiped down appropriately as she is COVID negative. She will be banded, her identification and important vital information will be validated and checked, and she will be moved towards the patient ward that is COVID negative. The ward status is based on her acuity versus the ICU. She does not require ICU level care. Which ward she is moved to is based on her COVID status. She will be moved to a COVID negative ward because her COVID status is negative. Due to the wards not being on the same level as the ICU, she will be moved via elevator because she is on a gurney. Gurneys and wheelchair movement is done via elevator. Only the ICUs are on the same level as casualty receiving. All other wards are below the level of casualty receiving and the ICU and require movement by elevator. In the event that the patient is COVID positive and does not require ICU level care, initially patients will be moved into our ICU isolation ward. This holds approximately 11 patients. Once this ward is filled, additionally 4 patients can be held in CASREC isolation ward. When that is filled, there will be a ward dedicated completely to COVID positive patients. This would be similar to the ward that this patient is being taken to, although it will be separate from and be an isolated ward only. The total portion of this transport process takes approximately 10 minutes from start to finish.